Hello, everybody. Good to see you. Just coming from another Zoom like we all are. Zoom to Zoom to Zoom. So I have my watermelon and my cheese.
Good afternoon, Ben.
Oh, Chuck, how's it going?
Going well, thank you. Oh, there's Karen. Hi, Karen.
Oh, we can't hear you, Karen. Sorry.
Sorry, I'm here. I probably need to leave at 1:30, if that's okay.
No, you have to stay an extra hour.
I'm a nurse in my spare time right now, so I gotta.
So how is your mother doing?
She's doing well. This was a tough one for her, but she's home and she's healing. And I'm a really terrible nurse, but I keep her laughing, so that's good.
Laughter's important.
Laughter is sometimes the best medicine.
Well, that's what she's telling me, so we'll see. But she's doing well. Thanks for asking.
Well, I know we have a fairly brief agenda, I think. Try and start something. I don't know if we have. I see Josh. I don't know if do we have any other commissioners on so far? Just trying to get an count for board members here.
I'll wait until phase 3. We'll be working from home for another couple of weeks at least, but well, we do have people going in the office, and so
looks like Al's on.
You see Al? Okay.
I see his name there.
yeah.
I don't
Counting
know
7.
I don't know who attendee 4 and attendee 9 is.
Yeah, I've been out a couple times, and that's been nice, and so it is nice to kind of get out, and it's nice that the restaurants are. Honestly, it's kind of more intimate now that you can go out and there's nobody sitting right next to you. So very good, been very good for us. So yeah.
Well, we're at our designated time. I don't know if we have. Close my Outlook so I don't have any more chiming going on. Are we ready to call the board meeting together? I don't see Ann. I don't know if Ann's on there yet.
I'm here.
Oh, there you are. What do you think, Ann? Are you prepared? Are we ready to call the board meeting together?
Yes. I think it is time. We have a quorum.
We have a quorum and everything. All right. I don't know if you were recording already.
We are.
All right. Well, welcome everybody to our next edition of Hollywood Square here, Board of Health style. For those of you that remember the old TV show. So welcome to the Board of Health meeting for May 28th. We'll go ahead and start with roll call. I don't know, Ann, do you want to do a roll?
Yes.
Go ahead.
Mayor Wick,
Here.
Councilmember Beggs, Mayor Freeman,
I know. I didn't hear
Mayor
you.
Freeman, we can see you, but we cannot hear you.
Nope, still not able to hear you, Mayor Freeman.
No.
He's our sign language interpreter today.
As we work through that, I'll continue. It's Commissioner French.
He's there. I see him on the screen.
Do you?
I see his desk.
Yeah.
And Board Member Frosted reported that she would not be at the meeting.
Okay.
Board Member Hafner,
Here.
Commissioner Kearns,
Here.
Hello.
Board Member
Hello.
Kenley,
Here.
Commissioner Cooney. I don't see her. Councilmember Stratton,
Here.
Councilmember Thompson,
Here,
Hello.
Councilmember Wilkerson.
Hello.
I know Commissioner Cooney just, you know. Can you hear us, Commissioner Cooney?
I can. I just got on. I was having issues.
It's okay. We're just getting through roll call, so I just want to make sure to acknowledge you were here. So, Andy, we just need a motion to excuse our one member, or do we want to give it some time here?
You mean Board Member Frosted?
Yeah.
We don't need a motion.
Okay.
We can move forward.
Sorry, I'm confused with my board meetings. I apologize. Do you have the agenda that you want to bring up for everybody, just so we can follow along with that, or? So for Chair's report today, just wanted to acknowledge all the hard work that everybody's been doing. I'm sure we're all aware that we're into phase 2 and we got the variance request through the governor's office, and just wanted to acknowledge everything that's gone into that. I'm sure we don't even know the half of everything that's been going on at the health district as far as all the staff hours that are going in there, but just wanted to recognize all the hard work that Amelia has done, Dr. Lutz, and pretty much everybody at the health district has dropped everything to get the COVID response going. And so just wanted to send a big thank you out to everybody that has been able to turn that around so quickly. You know, I think it was like a 21-page response to the governor's office for that last variance request that we did. And so I know a lot of hard work went into there, and just wanted to acknowledge and thank you guys and express our appreciation for everything that everybody's doing at the health district. So, with that, kind of looking at the consent agenda, is there anything on the consent agenda anybody wants to set aside to consider separately? Hearing.
Ben, this is Linda Thompson. Last time I didn't know when to say, but I need to recuse myself from voting on the vouchers.
Okay. Do you want to set them aside to consider separately, or are you just going to abstain from the consent agenda?
Let's set those aside, please.
Okay. We'll consider those separately. So anything else from the consent agenda? Anybody else? Hearing none, I'm looking for a motion to approve the consent agenda minus the vouchers.
Move approve.
I'll second that.
So moved by Mayor Freeman, seconded by Mr. Hafner.
Yeah.
And any further discussion on the consent agenda? Hearing none, all those in favor, please signify by saying aye.
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 All those opposed, nay. Motion is approved unanimously. Now we're looking for a motion to approve the vouchers.
So moved.
So moved. Was that Commissioner Cooney?
Yes.
Second by Commissioner Kearns.
Second by Commissioner Kearns. Appreciate that. Any discussion on the vouchers? Hearing none. All those in favor of the said motion, please signify by saying aye.
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 All those opposed, nay. And then abstentions, if you could identify yourself.
Linda Thompson.
All right. So the motion is approved with one abstention. Now moving to the action items. And on here we have a resolution which was drafted, submitted out for consideration. Resolution 20-06, which is requesting the allocation of funds to continue to cover the cost to combat the COVID pandemic. And I don't know, before we get into a motion, I know Amelia had put together a spreadsheet that was also out there. Amelia, do you want to kind of start by sharing how you kind of came up with some of the numbers and costs that we're seeing at the health district for our response?
Sure. One of the things, so we started tracking our expenses related to COVID all the way back to January 21st. And because we were, starting to get, staff time, equipment, rentals, setting up the screening site. So we have actually started tracking those items going all the way back to January 21st. As of May 14th, and I was going to also mention in the financial report, we are at a deficit of around 3.5 million. And with the ramping up of contact tracing, which is critical for us to be able to stay in phase 2, we're at about 4.1 million. In my report, I'm going to talk a little bit about the governance committee and how we're looking at different funding and how I've prepared this for talking with the commissioners about CARES funding.
So the idea and the thought was we know there's different pots of money that are out there, but we really wanted to, or I really wanted to figure out some way for us to get some more solid agreement in place as to where the funds are going to come from. Because as a health district, look at our financial reports, I really don't see that we have a lot of wiggle room or cash flow or reserves to be able to accommodate such a big influx in demand from the health district. But at the same time, we need the health district to really be able to come forward and do these to move us through the pandemic. And so that's where the thought for this resolution kind of came from, was to say, hey, we need help. We don't have the money. I know that as we went through this, there was actually a grant that we did receive through, I believe, the state. You could probably answer more to that, that we have received.
Yes, so we did, and I have it on there in income. We did receive 1.15 through the state, which also included federal funding that we needed to spend first, because we have to spend our federal funding prior to the state funding for the response. And then I also tried under funding source, it says CARES, which, so the amount that's listed would qualify for CARES funding if approved. And then FEMA would potentially pay for some of the other line items. So I've distinguished those as well so that we don't supplant any funding. And with the FEMA funds, we do have to keep in mind that there's still a 25% match. So we would have to use, some of our reserves or to pay for that.
So I guess maybe I should take a step back here, because this is probably the first time many of us have seen these different scenarios. Can you walk us through what the different scenarios are? You kind of have 3 different layouts in this chart that we're seeing.
Yes, so scenario 1 is where we currently are right now. Basically, that would be if we could continue as is with no additional contact tracing, which we know that's not the case, right? We have to have the contact tracing for phase 2. So scenario 2 really takes us into the contact tracing estimate of what it's going to be to have enough contact tracers working for us. We also have a big group of volunteers that are willing to help with contact tracing, which is helpful for us in terms of dollar amounts. If you'll notice, our 4 worst weeks, if you will, in terms of budget numbers for the response, we had staffing at right around 379, 550 for 4 weeks. And so my hope is that with the standing down of the Emergency Operations Center and just kind of watching our numbers, we will continue to decrease the amount of time, that we have spent specifically on COVID. So I'd be taking that down about 20% from now to the end of the year. I've included PPE in there, legal and public records request. We're getting more and more of those as time goes on. So scenario 2, if you kind of work through there with some of the different screening and safety equipment, the ACF having to have isolation all the different scenarios. Then scenario 3 on the list here is a surge plan. So this I've put 4 months in here at the high amount again, in case in the fall we do experience a surge and have to reactivate the emergency operations center, which would take us up to that more expensive $379,550, and also some increased need for additional PPE because of the surge, increased testing, especially with long-term care and having a long-term care strike team, and additional contact tracing due to the surge. So scenario 3, I think, is our worst case scenario. I hope we can stay in that scenario 2 area, because I think that seems to be the most realistic. I am still waiting on some dollars to come in, some different amounts related to setting up testing here locally with a partner, so that we could actually do testing within the city and not have to send it out. So I would build that equipment into this as well.
That's not taking the test, but actually processing the test and getting the results. Is that what it is?
Correct.
So can I comment on that?
Go ahead, Commissioner Cooney.
So Amelia, I want to say thank you. You know, we've been asking for numbers, you know, and you've had them. So I appreciate the fact that you've worked hard to get these numbers. You know, so I'm going to just speak to, I think, you know, we need to have Amelia come and talk to the commissioners. We're going to be looking at the CARES dollars more on Monday or Tuesday. I'm not sure which day Al's got set for us yet, but I'm not sure. I mean, I'm not sure that we need a resolution from the health board. I understand that you need the commitment. I'm one commissioner, Josh is on the line too, but I think, you know, as commissioners, we're going to be committed to making sure that we've got the money we need for contact tracing and all of that. Because if we don't have that, we're not to phase 2. I mean, it's like the governor's metrics bumped up the number of contact tracers up to 75. Is that correct, Amelia? You know, where we weren't anticipating.
Yes, the current guidance from the state is that for every 100,000 in our population, we have to have 15 contact tracers.
Yeah, so that was kind of a new metrics that we didn't even know about, that we needed to get up to. And as much as, you know, we're all about, you know, I don't want to speak for you, Josh, but I'm going to say, you know, for me, we're all about opening up businesses and getting people back to work and doing it safely. But, you know, we have to meet the metrics for the governor's office. Otherwise, he could take us back or won't let us move forward. And so I feel pretty strongly that this is a public health emergency. And so we need to be ensuring that the CARES dollars that the feds had given to us take care of the public health emergency part of this. And so I know you guys are looking for more than just a commitment from 1 or 2 commissioners, but you know, I'm not sure that we need the resolution, because I'm, you know, committed. I think I was in the papers saying I was committed to making sure that we've got public health covered. So I'll let Josh speak to it if he wants to, or anyone else.
Josh, do you want to speak, or you want me to?
Sure, well, no, I was just going to say, yeah, I mean, I agree with what Commissioner Cuny is saying. I don't know if necessarily a resolution is needed. I mean, we're weighing options of a lot of things. I mean, there's a lot of things that we could spend these CARES dollars on. Certainly, public health is one of those approved spending areas that's authorized with the guidance we have from the Treasury Department. But I mean, I think, you know, Amelia coming and presenting these numbers, or it would probably be by Zoom, but you know, presenting these numbers just to the 3 of us on the Board of County Commissioners would be sufficient. I don't know if a resolution is necessarily needed or warranted with this. So
just my thoughts, and I know Amelia put in there a column for funding source. But as we look at the health district and kind of making sure that we're covered what we have our abilities to do, I don't know that we're trying to tell you what funding source it comes from, whether it's CARES or FEMA or some other grant system or wherever the dollars come from. I just wanted to make sure to know that we don't have it in our funds. And so I know words and quotes and pledges are great, but I would just feel a lot more comfortable if we had some sort of formal agreement that says, yes, we can proceed down this path and that we'll get the funding back. Because as I look at the balance sheet for the health district, I just don't see how we could absorb or even a cash flow of the $4 million. I know FEMA sometimes takes a long time to come back and get settled through. And so that's the only reason why I was suggesting a resolution or something just to encourage, because I know you guys as commissioners are going to get all kinds of ideas and everybody's coming to you guys for funding. I was just hoping for some sort of encouragement to get it more formalized so that way we get some assurances as we go into whether it's contact tracing or any of these different items in here. Just knowing that the risk factor is pretty high for us as a district just because of our funding status.
Ben?
Yes, Chuck.
Does the resolution, if we voted on it in the past, would that hurt or help our cause to the two commissioners? So what's your objection to it other than the fact if you have all that in place or you don't have it all in place financially? Because we want to make sure that we do have that money to assist and help the district. So give me some idea of why it would be a detriment to do the resolution compared to not doing it.
Well, I would say for me, Chuck, it's like we're listening to people as to what the CARES dollars are going for, but ultimately the commissioners need to make that determination. So I think, I don't want to have every agency, every group sending us resolutions, saying that we have to help fund them. We know the health district, we know as county commissioners that we fund the health district. I mean, we're the ones that give the money, the 1.8 million that the health district gets initially. It's not any other entities that do that. So again, I'm very committed to funding. This is what the CARES dollars are for. It's a regional project. We're the ones who really are, set the funding for the health district, and I'm committed to ensuring that we fund the health district at this point. I know we're not just spending money and making bad contracts. We've been paying, I know Millie's been paying close attention, so I feel very comfortable, and that's, partly being on the board and being on the executive committee and you on the finance. No, I mean, you're spending your dollars as wisely as you can. So I think, that's why I guess I just feel like if in a month we haven't done anything, a resolution would be very appropriate. But I think you're going to see that we're going to have some resolution at the commissioners meeting.
So what you're telling this board is that you and Josh are both committed to the $4.1 million that we're going to have a shortage of.
Well, I can say I am. I can't speak for Josh.
Well, maybe Josh could speak now and say one way or the other.
Try not to put everybody.
Hang on, I've got Commissioner French reaching out saying he's trying to call. He's on the phone, but he says he's not being recognized to speak. So if he's trying to call in, he's hearing everything that's being said, but he says he's trying to speak, but for some reason he's on the phone. He called the phone number that was sent by Ann, but nobody's recognizing him or promoting him to be able to speak, I guess. So can somebody
apologize for that? We're not trying to do that intentionally by any means.
I'm looking at the callers right now, trying to determine which one he is.
Okay.
Josh, can he text you the last part of his cell phone number?
Well, I think we have that. Let me look here. Actually, I don't know what cell phone he's on.
So
Commissioner French, are you available?
Yes.
There he is.
Hey.
Yeah. So Can I speak to the resolution?
Please. We don't have a motion on the floor, but that's the item we're at first talking to.
So I would agree with Commissioner Cooney that I don't think the resolution is necessary. But let me speak to a bigger motion that I find interesting is that what this resolution does is it's asking that the county cover 100% of the cost. And as I raised this issue 2 years ago, and it was never addressed, and I'll raise it again now, if this is a regional organization, then why aren't all of our partners at the table sharing part of their CARES money to cover this cost? And so, once again, you're looking at the county to cover 100% of the cost for the health district. I think Amelia Clark and Bob Lutz have done an incredible job, and the staff there, kudos to all of them. This has nothing to do with the quality of work that they have done, but it raises an issue that's been on the table now for a couple of years and continued to be ignored. And I'm going to ask once again that, if we are going to be partners, then all of us share in this cost. And each one of the cities has CARES money as well. When are the cities going to come to the table and be partners in the health district? If we cannot get to a resolution on that underlying issue, tell me why the county shouldn't just fold the health district under the county like other counties have done across the state and make it a department of the county. We're the ones that you're asking to pay the bills, but yet you want to continue to have a say in the policies and the programs the health district is engaged in. If you want to spend money, be accountable and be there at the table to help cover the cost. But if you're not, then why should the county continue to carry the bill? So being able to fund this, I'm confident the Board of County Commissioners will fund this. We'll probably do it in increments so that we're measured. That would be my approach. But I would like to be able to give my fellow partners in the health district, till the end of August to figure out how do you share in this cost. And if you can't share in the cost, then I think there's another conversation about, is this the time to where we fold the health district under the Board of County Commissioners, because we're paying 100% of the cost for the local jurisdictions.
This is Chuck speaking, and Kevin, wasn't there a white paper regarding this situation to move forward with getting the other municipalities involved in it?
So, Chair Wick, this is Kevin Freeman, and can you hear me?
Yes, we can. Go ahead.
Okay. So, there is currently sitting, and both myself and Commissioner Cooney have been working on this. We had reached out to begin discussions at the Finance Committee level and at the Executive Committee level, preparation of at this point, we're calling it a Memorandum of Understanding, or an MOU. Michelle Fossum has drafted that, and we were looking at working on that, and then this interesting situation came up. But there is such a document out there. There will need to be, that obviously now requires a sense of urgency. I agree with Commissioner French and Commissioner Cooney and Commissioner Kearns that the county is the fiscal agent for the health district. They bear the burden of funding those portions of the health district that that are not funded federally or through state or through other grants and matches. I do think that if we, as municipalities, sitting in this chair, I represent 11 small cities. We have the city of Spokane Valley and the city of Spokane. If we wish to maintain our seat at the table, we need to figure out how that would look, and we need to pay to play. And so there is a document out there. Quite honestly, I will take some responsibility and not championing that as it's going forward. I understand that where we are now, particularly as we're looking at these shortfalls related to COVID, we need to bring that up. And so what I would say is that we can take that document, and at the next finance committee meeting and at the next exec board meeting, we can begin to bring that document together and bring it out for presentation to the municipalities in a form that we can discuss, hopefully to meet Commissioner French's time frame of August.
Yeah, and I'll just say that Kevin and we did meet right before all this happened, and so so it's been on the table. You know, when Commissioner French says it's been 2 years, well, we had an administrative health officer that retired as we were starting to go down that path, and we wanted to get Amelia on board. So it's been circumstances that have driven the delay, which were, you know, pretty important circumstances that we needed to take care of first before we went down this road.
Well, as the chair of the finance committee, I think we'd welcome that opportunity to work with you, Kevin and Mary, in order to go along and complete this task, because we've been talking about it for 2 years or more. And so maybe this gives us the opportunity to really get involved with it and complete it. And I think that would help Al also, and what his concerns are.
Chairman Wick?
Yes, Commissioner French.
Yes, so one way or the other, I want to be able to leave the health district with the assurance we are going to cover the cost. One way or the other, it's important. Commissioner Cooney said it very well. We need the health district to continue to do what they're doing so that we can get to phase 4 and get back to normal life, whatever that looks like. That will happen. I think the Board of County Commissioners is committed to being able to make that happen. The question on the table is how. This resolution says that it's all going to be on the county's back. And if in fact we are going to be partners, this resolution is premature. And so I think you've got all 3 commissioners that have already said we're supportive of the health district and the mission. So I don't think that the resolution is necessary at this time. I think it starts to shut down a conversation that otherwise needs to happen. And I'd like to suggest that maybe we table this until, I don't know, August 31 or September, and then readdress it at that time and give everybody the time to be able to say, what does the future of this organization looks like as a partnership?
And I don't object to having that other conversation. I guess just my question back to Amelia is, given our current burn rate through our budget and the finances that we have and the additional expenses we're going to incur, do we have enough cash on hand to keep us through August? Or do we need to have something more formal or dollars into the health district before August to keep us going?
I think based on what I'm hearing, I think what might make sense is that we take, when I meet with, I heard Commissioner Cooney say I would come over there Monday or Tuesday or via Zoom, however, and present, or maybe Commissioner Kern said that. What I could do is bring them my current, most up-to-date actual expenses and talk to them about that in line with the contact tracing of what we need to keep us in phase 2. And if we could talk through that over, if I could do that with the commissioners, you know, we start getting folks hired and in place for some additional capacity, then I would be fine with it. And I think like that is something, you know, we could talk about. It wouldn't be the full amount. It would just be get, you know, what do we need to get these steps in place so we can keep moving forward.
Okay. Yes,
This is Linda Thompson.
Good, Linda.
Yes, so I want to speak in support of the resolution merely as a way to be the catalyst for the conversation. What this resolution is requesting that the commissioners allocate necessary funding. That doesn't mean we're asking them to, you all to pay out of the county's money, whether it's FEMA or the CARES Act or whatever. But I think what I have watched and been a part of over this last few months, as the process for even how to open up to phase 2 was moving forward, we were doing exactly what we were supposed to do, starting with our health officer, the Board of Health voting, moving on to the commissioners making the request, following all that. In the meantime, there were a lot of organizations and others jumping in and sending messages to the governor, trying to influence the decision, which had a process of how that was to move forward. And everyone in the process was collaborating and working together to move that forward. And I am in support of having something very clear for what the process is. As we send this resolution, it is not saying right away, okay, we're demanding the county commissioners approve that the county pays. It's just a way to do the process. Maybe we can change some of the wording, but I think being able to track it and show here's what it was to support the process the commissioners are doing. I totally trust that it's going to get all taken care of in the end, but I really appreciate those who have really worked through the process and have followed the steps, which were easy to follow and resulted in us opening to phase 2. And I think there were times when the process might have been jeopardized by those outside of the process, sending letters to the governor or talking to somebody when the process had worked. And I guess that's what I'm doing, is advocating for a formal process so that it can be tracked. And I think the discussion about how funding for the health district happens definitely needs to happen, but I'm supporting the resolution for a process.
Okay. Mr. Chair?
Yes, Chair.
I suppose what I would propose is that with Amelia Todd going to talk to the commissioners, I believe either Monday or Tuesday of next week. Is that correct, Amelia?
That's what I heard. Yes, I know she's shaking.
If that's correct, and where it is, if we now are shortage of funding and be able to continue, that if the commissioners would be willing to provide the financial assistance until we can maybe come up with an answer for the other municipalities to become involved, then I'd be willing to table it until after Amelia's discussion on Monday or Tuesday and see if we can't get together in a cooperative manner to resolve the problem down the road.
Okay. So
This
currently,
is Kevin. I would agree with Mr. Hafner. I think right now, I understand what Ms. Thompson is saying, but I don't think this resolution says that. I think this resolution is there's a dollar amount in there. It's not really a process. We as the Board of Health are asking the county commissioners to fund to a dollar amount, and given what Commissioners Kearns and Kinney have said, I think that they understand and they know very, very well that they are the fiscal agents for the health district. They have made their commitment that they will keep this moving forward. And I think that we need to defer to them right now based on their, particularly Commissioner French's statements, that we need a process to understand what this organization looks like going forward. I think I would be happy or I would support leaving this resolution lay for the time being.
Hey, this is Council President Beggs. I'm borrowing Councilmember Wilkerson's computer because mine died, so I've come in. I just wanted to speak to a couple of things. First of all, I'm fine with waiting on the resolution. It sounds like there's a very straightforward way for Administrator Clark to go right to the commissioners and get relief. So I'm fine with that, but I really appreciate Chair Wick bringing this forward and really focusing on the solvency of the agency, because that's really our job. I did want to address the funding. I'm supportive of additional municipal funding, but I just want to go back to a presentation that we were given a couple years ago, is that the cities used to provide direct funding because we had a funding tax through the vehicle excise taxes that cities collected, and we paid a share of the health district budget. But when state law was changed so that cities no longer had that revenue, my understanding from the presentation is that the state of Washington then stepped in and has been providing the health district money every year, proportion to the population of our cities that we used to do it. So they replaced that. I think it's been pretty flat and probably needs to be higher, but it's not that the city's share hasn't been paid. It got shifted when their tax revenue source got changed. So I just hope that before we go down the full new agreements about it, that we revisit that and get that history for all of us, because we've had quite a turnover on the board, and I think I'm remembering it accurately, but I may not. I wasn't the one presenting it. So I really want to do that, and then kind of similarly note that the federal CARES dollars to the county was paid on a pro rata basis of populations, including in the cities, and so that represents that there. But I like the direction we're going, and I think it'd be great to have a conversation about more investment in the health district from all sources, including City of Spokane.
So as a process right now, we don't have a motion on the floor for adopting the resolution. But I think it has spurred the conversation that we really needed to have to better understand our response and finances and where those could be coming from. So unless I hear a motion to do anything different, we will just move on, and we can always revisit this next month if it needs to be.
Mr. Chair, do you need a motion to table it?
I don't believe so, because we do not have a motion on the table to approve. And
Okay.
so, unless I hear any objections to that. So hearing none, we'll go ahead and move on to I believe it's the administrative officer report.
Yes. So the two things that I had to talk about were the budget, and we pretty much covered that just now, but then also just to update the board members on what is the process now that the Emergency Operations Center is standing down. So tomorrow is the official last day of the Emergency Operations Center, which has been operating out at the fire training facility. And now, with the phase 2 variants and really looking at, we're not in an emergency mode, we're more in a response mode related to COVID. And most of the response comes back to public health. So in looking at everything that was happening out at the EOC, there are kind of 11 areas that, the health district has already been working on and will continue to work on while we still live in and with COVID. So from the EOC, there's discussion to create, and it's already been started with the creation of a COVID-19 recovery group. And the members of that group will be the county commissioners, the Spokane County CEO and CFO, the City of Spokane administrator, the City of Spokane CFO, Spokane City Council member, City of Spokane Valley administrator, myself, and then a representative from GSI, and a representative from the City of Spokane Valley legislative body. And then the mayors of the cities within the county, because these are open and public meetings, could also attend this recovery group, COVID-19 recovery group committee. And so at that committee, we're going to continue to monitor the different metrics related to the public health response and to what the district's doing. And at our executive committee meeting, we talked about putting COVID-19 onto our agenda as kind of a standing item under my report. And so Susan Joberg, which you can now see here in the go-to meeting, she's the operations section chief who has been working, side by side with Dr. Lutz, and who, as our health officer, is a subject matter expert that we'll continue to use with the governance committee or recovery committee. And then Susan is going to be an integral part of that by helping me just stay on top of all the measures, and then also present to all of you on an ongoing basis what those updates look like. So I can actually segue over to Susan and for a few updates. We can't hear you. We can see you talking.
Thanks, Anne. I was on my phone. Can you hear me now?
We can, thank you.
Thank you. All right, so hello, many of you, we have seen each other nearly daily for the last 11 weeks or so, so I appreciate being able to speak with you to our Board of Health today and being back at the Health District. So as Amelia indicated, and is not a big surprise, many of these operational areas are led and sort of owned by public health. So I just wanted to give some background to each of those tasks that then we'll be updating going forward each month. So the first area is related to community testing and assuring that there are safety nets in place for those without insurance or who can't afford to pay co-pays, so that there's not any limited access for COVID testing. The screening site at the fairgrounds that we had operated initially with the healthcare partners and then most recently with the Washington National Guard will have its last day of testing out there on June 9th. And we'll just be continuing to really promote our partnerships, in particular with Chaz, who are doing a great job as a partner at their 5 locations, testing people at no cost. So we'll be promoting that more heavily in that partnership. Another area is providing opportunities for individuals to isolate when they're COVID positive who can't safely do it in their current living environment, whether that's because of homelessness or crowded households or there's vulnerable populations within their home. So we will be transitioning from the fairgrounds to another isolation facility as of Monday. And that will be an ongoing service that we need to assure is available to the community. We'll continue with monitoring the healthcare system capacity by having actionable plans and processes in place should we need to ever activate an alternate care facility where patients would need to be cared for outside of a traditional acute or critical care hospital. That's sort of our worst case scenario version of the healthcare system. And though no one's anticipating that, part of our responsibility and commitment in reopening is that that plan is actionable and could happen quickly. The case investigation and EPI surveillance, which is routine part of EPI work, as you all know, and it gets reported on in terms of things that we're working on at every monthly meeting, is foundational to public health, and that's continuing. We will be growing EPI capacity for case investigation with the volume that is coming in. We knew that as soon as the guidance was opened up around testing and being able to test asymptomatic individuals who may have had an exposure, that we would see more cases, and that in fact is true. So case investigation remains foundational. The COVID positive follow-up and care coordination bucket of work. So the COVID positive follow-up was something that we actually started immediately because of outreach from the WSU College of Medicine and their affiliation with the Spokane Alliance to voluntarily allow people to opt in who would like to have daily monitoring while they're in home isolation. And so that was a really early on great opportunity for us. And clearly it is an excellent strategy because it is one of the requirements. Care coordination is one of the requirements for us moving into phase 2. So we're continuing to build out that program in-house as well as in partnership with the medical group providers at Providence, Multicare, Rockwood, Kaiser, and Chaz. So that piece will just continue to grow. Again, its intention is to be able to support people in home isolation so that they can remain there safely and for the duration of their isolation time. Amelia already spoke to quite extensively to the case contact tracing. That is also a significant requirement from the governor's office. The concept of case contact tracing is normal epi business, but in this time of extraordinary volume, being able to have an army and a plan of case contact tracers has been critical, and Steve Smith has done a terrific job of building that plan to meet the requirement. The first set of individuals to support contact tracing will be internal to our agency and will go live by midweek next week. And then the next wave of those will be online by June 11th. So we're right on track and where we'd hope to be because of that hard work and planning. Infection prevention is another area that is part of the health district and will continue forward, and that's direct support to skilled nursing facilities. So not only do we have health district expertise in focusing on skilled nursing and assisted living facilities, but we're also working side by side with that multi-care drop team. It's like a strike team that will go into an alternate care or into a skilled nursing facility that's experiencing an outbreak, so they can get on top of that as quickly as possible. Fatality management, we're in close contact with our healthcare partners and the medical examiner's office just to monitor volume and the need, with already plans and resources in place to expand capacity should that be necessary. So those are the main buckets of work that Spokane Regional Health District has direct responsibility for and carries the weight of those. But we also have a few other areas where we're actively involved with our community for community health and safety initiatives with ongoing programs that are led by other organizations in the community, and we'll serve as a conduit of monitoring and sharing information about those established indicators. And those are things like behavioral health access and needs, food continuity and food security, so working really closely with food banks, Second Harvest, Northwest Harvest, et cetera, on some of the indicators that would show us early on that things aren't going in the direction that we want as part of the outcome of COVID. And then childcare, intimate partner violence, those are all different coalitions and bodies of work that we have staff involved in, but are led by others. Amelia, was there something more that you would like me to make sure I'm covering when I report to the board, or any questions for me?
I think that was a great overview. That governance committee or recovery committee, we are meeting on Tuesday, and we're going to, Susan and I are going to work internally to develop what our metrics are that we're going to report out to that group on a weekly basis. So I think going forward, we would just share those metrics with all of you as well. So thank you, Susan. And I guess just if there are questions that Susan or I could answer, this would probably be the time.
Questions from the board at all? No, seeing none. All right, Amelia, is there anything else for your report, or?
No.
Nope. All right, questions for Amelia for her report? Seeing none, we've gotten into a quiet group again. I know Dr. Lutz had to step away for a little bit. I don't know if he's back on here with us today. Dr. Lutz, are you there? Hearing nothing. I don't know. Remember?
Mayor Wick,
Yes.
I can reach out to him if you would like to hold and move on to another item, or just hold.
Well, we can move on to the next item, and if you want to reach out to him while we're talking about the next one. Although I don't remember what the next one is. What is the next
It's
one?
finance. It's the financial report.
What? Go ahead.
Yeah, so it's like the Amelia show today. So, the financials you all received, they were also presented to the Budget and Finance Committee. We met last week as well. You can see on there that we do have a deficit, but we also know that we're working on securing the COVID dollars. So I think that will end up working itself out. So any questions on the financials?
Questions from board members? I know I just want to try and make sure that we're getting our financials under wrap. So hoping to have those discussions sooner than later. All right. Well, that was quick.
Yeah.
All right. I don't know if Dr. Letts has had a chance to join us yet.
He is still involved in his other meeting.
Okay. So I don't know that we really had much of anything else. Is there anything else? What's left on our agenda then? Nothing. Okay. Councilmember Thompson.
Yes, I would just like to acknowledge the number of public comments we had for this meeting. Since we can't have public comment, in person, I think it's important that we acknowledge the comments and really focused on the responsibility or the actions of board members representing the board or themselves out in the community. And I just think it would be something that maybe we need to go back and look at our commitments as board members, what we can do and how we can speak representing the Board of Health. And so I would just like to acknowledge that and perhaps put it on an agenda item down the road to take a look at that.
All right. I think we talked a little bit about that, and I think it's on the advanced agenda for a presentation, just as a refresher for all of us. I can't remember if it's the next board meeting or not, but I know we had discussed putting that on the advanced agenda for a future meeting as well, since I have so many new members as well. Any other board member comments? Trying to stall to see if Dr. Letts is going to have a chance to join us or not. I guess the only other thing that I had thinking about it is Kelly has done a great job being our PIO and information officer, trying to get information out there. And as we try and transition to more of a recovery, it sure would be nice to have the ability to do press conferences a little easier at the health district. And so I just wanted to kind of put out there to see if we could try and figure out what the cost would be to enhance our facilities there at the health district to be able to have, the Facebook Live events and things have been watched by tens of thousands of individuals, and it seems to be the new way of communicating. And I don't see the slowdown of communication coming out of the health district. So I guess I'd just like to see us come forward, and I don't know if that's Kelly or Amelia or whomever needs to kind of look at what we need as a health district to improve our facility, so that way we can do more of those kinds of things within our own facility to improve our operations as well.
Yeah, Kelly and I have already started discussion around that and kind of just brainstorming what would that take. So that's definitely something on the radar.
So,
and this is Linda Thompson again. I'm very supportive of that, especially at one of the recent board meetings. We talked about getting our numbers up for mental health help, crisis numbers. I asked if maybe they could be shown on the background or somewhere at all of the updates, because there's just so much need now for people to know where to call to get help. And if we could, somehow get technology where it would run across the bottom, or it would be somewhere of some kind of a video or live update, that those numbers could be there, because we want to make sure those numbers are available in all kinds of venues where people might be able to get the help. Also seeing with domestic violence, an increase in violations of no contact orders. And just, how does somebody find help when they're in a violent situation, when they're required to stay home or staying home and home is not safe. So I think it's just would be great to have those facilities where we could do updates and things.
Commissioner Cooney?
So in the Domestic Violence Coalition, they actually have a great page that has all that information on it. And so, I mean, we could do a link maybe with it, because I know we got that out to all the police officers, all the sheriff's deputies, school districts. So they've done a great job getting that information out to everybody. And it's a one-page, really easy, has all the phone numbers on it. So anyway, so I think that'd be pretty easy to link to. And then I don't know, I was on the Domestic Violence Coalition meeting yesterday, and Lydia, she got an award. So Amelia, did you see that?
Yes, yes, it was very hard to keep that a secret. I knew it was happening, but Lindia Wilson, and it's actually going to be called the Lindia Wilson Annual Award from the Domestic Violence Network, and promoting advocacy, and all the people who are working really hard on the ground to help folks. So very proud of Lindia and her work, and I know a lot of us submitted nice things to say about Lindia, and that's going to be her award annually in perpetuity. So it's a great recognition of her work.
Yes, so I just wanted to make sure we let everybody know that, because that was awesome.
Yeah, it was great.
And then I don't know, Kelly, if you guys are going to do a press conference on that, or press release.
Probably. I've been trying. I know there was a couple recognitions right when COVID started that I wasn't able to recognize. So I want to make sure that I do it in a way that's inclusive of people that kind of have gotten forgotten over this time. I do want to also share that our team put together a very inclusive webpage that will be shared on the COVID website, as well as on our health district's website, of resources for mental health and crisis issues. So we'll be getting that out there a lot more too. And I think on the Facebook side, when we do those Facebook Lives, we're at the mercy of Facebook. That is not as much of the technology need. More it's about being able to connect flawlessly with Facebook. But I think there's some ways that maybe we can get that crisis information on there. But we are a little bit restricted on what we can do to run numbers and things on the video. But when we're in the comments, we try to get numbers, especially when they pertain to the topics. So when we've covered mental health issues, try to get that in there so that viewers would see those pop up with the comments. So we'll continue to do that with other topics, even if it isn't about mental health. So I can talk to the team about that, definitely.
Well, and I just want to be clear, I'm not being critical of anybody, or
I know
resources out there. But when somebody's on Facebook and they can see that number, they can say, hey, I know my neighbor needs to get some help, or I'm just saying the venues in such critical time. I was just on a call with the National League of Cities with Women in Municipal Government, where the whole conference, the whole hour was about domestic violence and how cities are not nearly as progressive. Many are not as progressive as we are in this work, because we do have these collaborations, and so anyway, not being critical, just saying, there's a
No, it's fine. I love good ideas.
All right. Amelia, did you have any or thoughts of what Dr. Lutz was going to share with us, or anything important that he was going to bring up?
I think he was just going to do updates on the numbers. He did not share with me his report.
Do you have any updates on the numbers? I just don't want to take up any more people's time here. Just trying to be respectful.
I do not. They're probably somewhere in my email that I need to get to, but I have not seen them yet today.
Sorry,
I can share that we've had 540 positive cases today. That was our update. 83 hospitalizations with 8 current. And it doesn't look like we have any new deaths, so we're still at 31.
Amelia, this is Kevin. I have one quick question. Do we feel that we have the Pasta USA outbreak locked down?
I think that we're doing all the contact tracing associated with it, and that we're working like one-on-one with that company. So I feel very positive about the way it's going.
Have we gotten any feedback from state DOH on how we handled that, particularly coming straight, having that when we came straight into phase 2? Are they feeling that we got it?
I mean, when they were actually on the phone with me multiple times before we got the phase 2 approval. And I explained to them exactly, you know, what our plan is around contact tracing, how we're mobilizing that in the community, what our training plan is. And so, you know, that was with Secretary Weisman and Dr. Lofi, and, you know, they both felt comfortable enough that we would, you know, be able to move forward to phase 2, because it's, you know, ultimately Secretary Weisman's say on if we move forward. So, yeah, I mean, I think that, you know, we're still obviously monitoring everything closely, and that's why it's so important we do all the contact tracing so that when we have these outbreaks pop up, we can get everything, all the resources around them that we need to in order to make sure we test anyone, you know, that would have been a significant contact.
Thank you.
Okay.
One more question. You had her hand up first. Sorry. Go ahead, Commissioner.
So, Amelia, I was going to have Dr. Lutz talk about it if he, you know, but with him not here, talk about kind of a community outbreak versus a isolated outbreak and kind of what the box it in means and all of that. Because I think as, you know, now that we suddenly have all these cases, you know, and some are isolated, some are not, some are community. And I think it's good for us to know as we get out the community members.
And I'm actually, Susan Joberg is still on here. I can see her. Susan, you still there?
Actually,
I think Dr. Lutz is on.
Yeah.
Dr. Lutz?
Yeah, I'm here.
Oh, okay. Well, Dr. Lutz can talk. He can give you the numbers for outbreak and the difference.
Marion, I'm sorry, can you go back? I just heard half of the question, so my apologies.
Yeah. Oh, no problem. So thank you for coming on with us. So the question is kind of as we moved into phase 2 and we're seeing the numbers increase, we know some of those are isolated to, you know, the macaroni factory. We know some are, you know, may not be, and some are community. And so what does that really mean? And kind of how are we handling differently, and what does boxing it in mean for us? Just because we're getting questions from community people, you know, about what does this all mean?
Sure. Yes. I mean, when we look at, you know, the definition of an outbreak for COVID-19 is 2 or more cases with, you know, that are epidemiologically linked. And so we can certainly go back to the Philadelphia macaroni factory, and see that when that began, we've had a number of cases that we can link directly or indirectly to that. And again, I think that speaks to the nature of COVID-19, that it tends to move very, very quickly, especially in areas where people are closely packed and in situations where people are living close together, so homes and things of that sort. So we have seen this outbreak at Philly Mac plant go from it to individuals in homes and then throughout those homes. That certainly accounts for the greatest number of cases that we're dealing with right now. You know, our concern is that if we have additional outbreaks that we cannot necessarily link to this outbreak, so elsewhere we have no link to this, that indicates another community outbreak, that for us is the greater concern. So when we're looking at boxing this in, you know, using the governor's language of boxing in the virus, the idea is that by very, very robust testing, and again, I also make a note of the fact that because we are doing more testing, we are seeing more cases. So that again is sort of an underlying foundational piece going forward. The more testing we will do, the more cases we will see. And acknowledging that for example, in the Philadelphia macaroni plant, 50% of the individuals who tested positive were asymptomatic at the time of being tested. So the fact that you have symptoms, the fact that you don't have symptoms, you're still infected. So again, for us, we want to be able to box this in. This means, as has been described, we need to be able to do robust case and contact investigations, reaching out to those individuals who are potentially at risk and or again defined as being at risk, and really strongly encouraging them that they need to be following guidance, symptom monitoring, as well as staying home. And it's our intent and our hope that maybe this is sort of a reminder to people, in a sort of Schadenfreude way, that we're not in front of this virus. The virus is with us at this point. But for us to get in front, we need people to actively participate, to continue to follow all the guidance. And when they are contacted by the health department or any of the volunteers that we will be working with, because they have been in contact, they really need to abide by that guidance and recommendation. Does that help?
Yes, no, that helps. Thank you. And so I guess one of the questions is, as we look at numbers and see, like, yesterday was 23. I don't know what today's increase was. How do we know if that's community spread, or do we know if that's contained? I guess that's part of the question too that people are asking.
Well, again, it speaks to the fact that as we do our case and contact investigation, can we find a link? Can we find a link? It may be one length away, it may be 3 lengths away, but can we relate it to the specific outbreak? And to date, for the most part, we can, which is encouraging. So I think the message that I would share with your constituents, the message that I've been trying to put out, that all of us are trying to put out, is that we have an outbreak. It is related certainly to the situation at the Philadelphia macaroni plant. We have continuing investigations going on. We have spotty cases here and there that are not necessarily linked, but they do not constitute an outbreak per se.
Okay. And so if you see the numbers to a point where you feel like there is an outbreak, you're going to alert us so we can make sure that people are aware.
Right. And our requirement, Mary, Commissioner Cuny, is that if we define a new outbreak, we have to, again, be in conversation with the Department of Health within 6 hours of defining that outbreak. And so our staff has been very diligent in doing so. And to date, Department of Health has been very supportive of the work that we're doing and do not feel as if we have to do anything differently. But acknowledging again that our numbers, I look at, for example, over the past 2 weeks, if I go back from today, 2 weeks, we have seen 146 cases. And as of today, our numbers, we had 540 cases, which is an increase of 14 from yesterday, with 83 total hospitalizations, 7 of whom are still 7 of individuals in the hospital.
Okay, thank you.
Yes, ma'am.
Dr. Lutz, I think our last agenda item is your report. Did you have anything additional you wanted to share with the board today?
That's not COVID-19 related.
This is your report, so however you could.
I know. Sorry, President. This is an interesting time for all of us. I really am so grateful for the great people that we work with here at the health department. This past week has been very challenging for all of them. I mean, again, just to be beset by this great number of new cases, acknowledging that we kind of expected it at some level, but irrespective of expecting it, to actually experience it is something different. We're in phase 2, and phase 2 does not mean that it's business as usual. It means that business is a little bit more open, but it's still all the practices that we have been encouraging people to do, the physical distancing, the hand washing, the staying home when ill, need to be really emphasized. And I cannot ask the board enough to really emphasize that as board members and as those of you who are elected. People will listen to you. They'll listen to you somewhat differently than listening to me. So again, that message really needs to be out there consistent. And I really encourage us to try to manage expectations. Yes, we talk about 3 weeks between phases. That is the ideal. It's also not the practical. And so none of us here ever thought that we would move linearly between phases 1, 2, 3, 4. We will move forward and maybe take a step back, but hopefully always moving forward. And so I'd ask you to help us to manage the expectation. Yes, the 3-week clock started last Friday. The 3-week clock is undoubtedly going to be extended, and people need to understand that going forward, there is no timeline. It'll be when we are comfortable with where we are with the data using the metrics that have been provided to us by the Department of Health. So, it's a challenging time to manage expectations. Certainly with the holiday weekend and with moving to phase 2, everything I've heard from people who were out and about tell me that people were out and about. And I hope that I don't continue to see this increased number of cases throughout the next 2 weeks, and or I see more community outbreaks, because that will definitely be a setback for us in some level.
Chair, I have a quick question for Dr. Lutz from a couple of my small cities. You pretty much made it clear that Dr. Lutz, you were going to wait till phase 3 before opening up play structures in parks, things like that. Is that your hard and fast rule? Or if we don't see the community outbreaks, would you consider moving toward opening of play structures prior to phase 3?
And I'd certainly give it a consideration, Mayor Freeman. I think it's reasonable. The big issues around play structures were essentially 2. The fact that I can't necessarily prevent people from gathering around play structures. I may have a few number of kids, but I also have parents. And so there was that issue combined with, the actual sanitation piece. The sanitation piece is not as concerning to me during the summer when I have UV light, which we know takes care of the virus. But I am concerned about the fact that I'm going to have 10 kids or 15 kids and parents doing, playing on those structures. So I think if there was a way, which would be challenging, but nonetheless to limit the amount of use on the structures, I would be more than willing to entertain a conversation. But as I said, for me, it's still sort of phase 3 until I really feel like I'm fully in front of where we are right now.
Thank you for that answer. Appreciate it.
Ben?
Dr. Lutz, this is Commissioner Kearns.
Yes, sir.
I had a question about, so where are we as far as testing capacity today? So since we have all these other medical entities that are offering the testing, are we comfortable? We're still at a point where anybody who has symptoms or would like to be tested could be tested?
Correct, Commissioner. And I just saw an email earlier on that we just got verification that we have another 500 testing swabs and viral transport media made available to us. So yes, every conversation that I've had to date with community providers have indicated that we are in an okay place right now. But I think we have to acknowledge that, for example, as of yesterday, again, being at the end of the month, we have received at the state level, I want to say 75% of what has been promised to us with respect to swabs, and something like 60% of what's been promised to us by the federal government for viral transport medium. So we have what we need right now, but I am still concerned about the pipeline going forward.
Okay, thank you.
Always a cheery report from Dr. Lutz.
Yeah, Mr. Sunshine, I've been called before. I prefer Dr. Doom and Gloom. I just prefer to be a realist.
No problem. We appreciate you, Dr. Lutz.
Ben, this is Chuck. I do have a question for Amelia. Could you talk a little bit about the status of the replacement for Mike, please? Where we are with the selection of a new financial officer?
Sure. We have retained a search firm to help us with that, and I signed the contract, I think, last week. So the search is beginning. I sent them the list of names of staff and different folks they're going to talk to, because it's going to be a deputy administrator in addition to having the financial oversight. So more than just the finance.
Okay, thank you.
Uh-huh.
All right, any final comments from any of the board members still here? If not, thank you everybody for coming today, and I'm looking for a motion for adjournment.
I'll make a motion to
So-
adjourn.
And I'll
All right.
second.
I'll second.
Thompson.
All right, so moved by Mr. Hafner and a second from Councilmember Thompson. All those in favor, please signify by saying aye.
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 All those opposed, nay. Hearing none, motion to adjourn is approved. Thank you, everybody. See you next month.